What's up, dentists? Welcome to the next section of the training. This is the patient experience section. First off, I want to congratulate you on your commitment to growth and improvement. If you're at this section, it means that you should have completed the brand training. If you haven't already finished the brand training, make sure you stop, go back, finish up the brand training, and then get back into this video. This section is all about the patient experience. In the next few videos, we're gonna go through what the patient experience is, what metrics can be used to track how good your patient experience is, and who is responsible for each part of the patient experience. Let's start off by agreeing on a few things. The first thing we need to agree on is that there is a marketplace for dental services. This means that dentists are competing against one another to earn someone's business, and that the patients have the luxury of being selective with whom they want to work with. The next thing we need to agree on is that patients generally don't understand whether or not the actual dental work or the clinical work is good or bad. So their perception of quality is going to be almost exclusively based on the totality of their experience, not just the quality of the clinical work. If they feel respected and well cared for, there's a pretty good chance that they're going to perceive their dental treatment or their dental experience to be great, even if the actual quality of the dental work isn't that good. On the flip side, a patient could go see the most clinically gifted dentist in the entire world, but if the dentist isn't charismatic, if the team isn't friendly, and if the office is kind of old and dingy, it doesn't really matter how good the quality of the work is, the patient's perception is still going to be that the treatment was of poor quality. So what do patients actually care about? According to a study published in the McGill Advisory in 2012 by Dr. Bill Rossi, the top 10 dental patient complaints are as follows. 1. Doctor and staff pushing unnecessary dental services. 2. Poor billing and insurance practices, including hidden or deceptive charges. 3. Poor quality dentistry or incompetent doctor and/or staff. 4. Rude and disrespectful front desk staff. 5. Unprofessional staff behavior. 6. Doctor not operating on time, lack of consideration of patient time and scheduling. 7. Doctors not compassionate, insensitive to patients. 8. Rushed clinical treatment. 9. Painful treatment. 10. Old, dirty, or uncomfortable office space with out-of-date equipment. So this isn't exactly rocket science. Patients have options when it comes to choosing their dentist, and if you don't actively focus on avoiding those top 10 patient complaints, you're gonna have a poor booking rate and a poor retention rate. On the flip side, if you act in line with your vision statement, your mission statement, and your core values, you'll be able to give your patients an amazing customer experience from start to finish, and you'll be able to depend on referrals and reviews instead of hit and miss marketing. So now that you know what people care about, let's go through the journey a prospective patient goes through to find and choose their dentist. So chances are it's all gonna start with some kind of need recognition. The patient probably realizes that they haven't seen a dentist in a while and their mouth is feeling kind of gross, or they have some kind of tooth pain. Next, the patient is going to look at a few different options. They might ask their friends for referrals. They might go on Google. They might think about what dentists are nearby from a location point of view. They might see which ones their insurance provider recommends. If the patient likes your website and likes your reviews, they're going to contact your office to inquire about an appointment. So typically they're going to do this through either the phone or through email, and it's really, really important that your receptionist does a great job answering the phone or responding to the emails promptly. Hopefully, the receptionist is well trained and does a great job converting that lead into a consult. So the next part of the patient experience is everything that happens before the patient meets with the doctor. So this is going to be your appointment reminder. This is going to be their experience when they walk into the office. This is going to be their waiting room experience. This is going to be their new patient intake form or health history. And this is going to be any new patient onboarding steps. Now the next part of a patient experience is hopefully going to be the new patient consultation with a practitioner, and you're not doing this in a treatment room. We want you to be doing your initial consultation in a friendly, warm, and welcoming environment that's not clinical. After the consultation, the next step is the new patient exam, where you have a great opportunity to make a lasting first clinical impression. After the new patient exam, there's going to be the first treatment. So if it's a new patient exam and cleaning, then the hygiene treatment will be next. After the first treatment, there's either going to be some kind of case presentation or you'll jump straight to the next step, which is the checkout experience. After the checkout experience, it's any activities that happen after the patient is no longer in your office. So these are going to be things like your follow-up, your rebooking, your request for a review or referral, etc. So as you can see, there's a lot of different steps that a patient goes through when it comes to finding and choosing their dentist. So if you're able to optimize your patient experience, you're going to be able to increase your profitability and expand your practice. In the videos to come, we're going to talk about the different metrics that you can track to make sure patients are having a great experience and who is responsible for what when it comes to optimizing each step of the experience. So thank you very much for watching this video, and we'll see you in the next class.